Uh, Greetings everyone. As some of you may know, my name is Tanya Aman and I work in early learning program at George Jefferson School as one of the educational assistants. The topic I will be talking about today is behavioral disorders in children. The reason I chose this topic is simply that we as staff constantly working with children are most likely to detect the onset of behavior disorders as early as in early learning and child care facility. However, it is important to be noted that a child under 5 years of age is rarely diagnosed with a serious behavior disorder, but he may begin displaying symptoms leading to behaviors later on. The behavior of a child is how a child acts and deals with people in private and public. It can be according to his personality, his physical appearance, and of course his age. When does a normal behavior become a matter of concern? There is a very fine line between what normal and acceptable behavior is and what is not. The Child Behavior Checklist, also known as CBCL, is available on the website, which shows what type of behavior in children is to be taken notice of. It's when the child starts acting out or has no control over his emotions that we say that such a child has behavior issues. It can be in the form of defiance, an outburst of anger, it can be verbal abuse or physical abuse, simply ignoring or even arguing. The most common behavioral disorders children have are attention deficit hyperactivity disorder, also known as ADHD, oppositional defiant disorder, ODD, autism spectrum disorder, ASD, anxiety disorder, depression disorder, bipolar disorder, conduct disorder. I will briefly explain to you what each one is. Attention deficit hyperactivity disorder, or most commonly known as ADHD, is the most commonly known mental disorder in children. As the name suggests, children will have poor concentration but will be hyperactive and have some learning disabilities. They will have trouble paying attention, and this can be seen interfering with school and home life. Children are also found to be overactive and impulsive. ADHD is found more in boys than in girls. It is found to be commonly observed during early school years. A child with ADHD is easily distracted and is unable to finish his tasks. He is fidgety, he tends to daydream and often loses things. ADHD can move on to teens and often to adulthood as well. Children with ADHD can be helped by teaching them how to problem solve so they can deal with situations and be able to handle them. I want to show you a 2-minute video clip. I'm sure you will find it interesting.
How old are you?
6.5. 6.
And what grade are you in?
First grade. First grade?
Do you like school?
Yeah.
Why do you like school?
Because I like to play with my friends at recess.
And why don't you like school?
Because I have to do a lot of stuff and my little sister's really cute and I want to spend more time with my little sister.
How long does it take you to do your homework? A long time or a short time?
Maybe 5 or 10 minutes. I don't know, sort of in the middle.
Do you have a hard time with your homework?
Sometimes.
How do you do on tests?
Good. Well, I usually get A's, but not A pluses, so I don't know. And I almost get everything a 1.
Well, aren't you still proud of yourself for getting A's?
I don't know, I just feel normal.
You just feel normal? You don't feel proud of yourself?
No, I feel normal.
Do you have a lot of friends?
Yeah. No.
about having a lot of friends? How do you feel about not having a lot of friends? Do you get invited to parties?
Yeah.
Okay, so that was our 2-minute clip. So the next disorder we are going to talk about is oppositional defiant disorder. ODD is a behavior where the child is argumentative, manipulative, and has a tendency to blame others for anything that goes wrong. Along with arguing, such a child loses his temper and is found shouting and being disruptive. He's also defiant, not following rules and always questioning rules. Such a child is also very sensitive and gets annoyed very easily. Cognitive ability skills and social training skills can help the kids fully be in control of their temper and work around problems. The third disorder we're talking about is autism spectrum disorder. It is a neurodevelopment disorder in which a child has some developmental delays that affects his social interactions, communication, interests, and behavior. A child with ASD seldom makes eye contact, makes few gestures like pointing or waving his hands, and he does not have any facial expressions, nor can he understand them. Autistic kids can be nonverbal, using very little vocabulary. They can also have a sensory processing issue, which means they are hyperactive, hypersensitive to light, sound, textures, smells, or other sensory input. Autism is a lifelong developmental disability that affects how people perceive the world and interact with others. Autistic kids can be helped by building skills, strengthening what the child is best at, and giving the child tools to overcome his weaknesses like social interactions and plays. I want to show you a 2-minute video clip of an autistic child.
I'm autistic and I just get too much information.
Sorry. Thank you, Lisa. Okay. So we're done with autism spectrum disorder. The next disorder that I will talk about is anxiety disorder. As the name suggests, this disorder is about being worried, scared, and afraid. Children become worried about school, their health, family members, etc. A child will get a sudden panic attack which will result in physical symptoms like pounding heart, shortness of breath, weakness, etc. When such symptoms happen, the child is unable to finish his tasks at school and lags behind in his coursework. We can help children get over their stresses by showing them how to do breathing exercises, distracting them, talking to them, helping them to think positive, and by maintaining a healthy lifestyle with regular exercises. Depression disorder is next in line, when a child feels sad, pessimistic, helpless, and hopeless persistently. These are all signs of the depressive disorder. Such a child might lose interest in hobbies or any interest he had before. He may also feel useless. These conditions can be helped by medication and by giving priority to the child. Bipolar disorder is next in line. It's another mental disorder where a child can have severe mood swings which are very different from the normal ones. The child can be impulsive, hyperactive, aggressive, and portray inappropriate social behavior. If the child shows symptoms of bipolar, some basic things you can do is to be patient, encourage him to talk, and then listen to what his troubles are, and be patient with him, and help him have some fun. Medication and psychotherapy manage bipolar symptoms. The last one on our list is conductive disorder. Conductive disorder is a serious mental disorder in which a child uses aggression towards others, which can be portrayed as hitting, pushing, and biting. Conduct disorder is termed as antisocial behavior. The treatment for conduct disorder is through psychotherapy and behavioral therapy, where the entire family and the child is brought into the loop. The symptoms of child behavior can range from very subtle to very obvious. The reason for such an attitude can be medical or congenital, learning disability, or simply delayed development. All these conditions can be corrected or tamed by medication. Often, as staff working with children, I can see behavior as a reaction to anything that is challenging or difficult. I can then modify the task what the child needs to do and to cater to his needs, which in turn simplifies his condition. Catching the child in the moment and praising him for his positive works wonders. I want to summarize my talk today by quoting Monica Nowrosky's "Thanks for chucking that at the wall instead of me, teaching at risk children and youth," 2007. Nowrosky 2007 reports, when kids have experienced some taste of success and start to believe in themselves the slightest bit, they develop the courage they need to really look at themselves and start to make changes in their behavior. Thank you.